Awesome. Hi, everyone. My name is Haley Rockenbach. I am the SNAP ENT Senior Associate at the National Community Action Partnership. This webinar is Navigating the Complexities of SNAP Insights and Updates for Community Action Agencies. This is a part of our SNAP Employment and Training webinar series. So very happy to have you all on the call today. Our webinar today will be led by Andrew Schramm from APHSA. I will hand it over to Andrew in just a second, but I want to start with the promise of community action, which, as we all know, and I will repeat, you could read along with me, is community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So without further ado, I'm going to pass it to my friend and colleague, Andrew, to take it away.
Hi, everyone. Good morning to some, good afternoon to others. Really happy to be here and be able to share information on the SNAP program, which I'm sure many of you know a lot about. But there's also a lot of nuance and a lot of other pieces that kind of go along with it. Also, just to share, I'm with APHSA, which is the American Public Human Services Association. Our membership is state human service agencies and staff. So just to say up front, today's information presentation is really informational. I'm not intending to advocate for any individual policy, but I want you to have this information if you feel that the policies in your state, may fit or not fit your, individual clients. That's something that you can look to, or just, providing ways that you can help your clientele. Also, just a few things to keep in mind as we move through today. SNAP is really hugely beneficial for millions of people, and it can open a lot of other opportunities to other really beneficial programs. However, SNAP is really just one program that people can access to support their households. So we'll talk a little bit about other programs that may look similar or sound similar, have similar eligibility to SNAP. And then lastly, keeping in mind, and we'll really hit on this pretty specifically today, is that SNAP is a federal program, but it really is, there's a lot of latitude given to states on how they structure their programs, a lot of options that they're given to be able to provide specifically to their states, their counties, how it works on a local level. So what I'll encourage you to do now and as we move through is think about how your state specifically interacts with SNAP and administers SNAP, because some of these things may not happen in your state, may not work exactly how we're talking about it in your state. So it's good to be kind of knowledgeable about how your state works individually. Also, if anyone has any questions, feel free to put them in chat, come off of mute, raise your hand, whatever works best for you. And I hope that we have a couple of opportunities today to do some peer sharing or share kind of things that you've been working on with your clientele with SNAP as well. All right. So SNAP basics. SNAP is the Supplemental Nutrition Assistance Program. Some states may have different names for it as well. So food assistance, it used to be called food stamps, and that's what other people may be more familiar with. Again, a federal program that provides nutrition benefits to low-income individuals and families that are used at stores to purchase food. It's administered by the USDA Food Nutrition Service, and that's FNS. So if we refer to FNS, that's who we're referring to, through a nationwide network of field offices. The field offices are responsible for, excuse me, licensing and monitoring of retail food stores participating in SNAP, along with a lot of other pieces that they coordinate. SNAP is a part of the overall strategy that the Food Nutrition Service has to support people with food in the country. And And just one kind of, I guess this is the biggest part, but just one part of the kind of group of services that they provide. This is a very high overview of eligibility for individuals. Again, this will be state specific, but here are kind of the general overview pieces from the federal government. So we're looking at 130% of the federal poverty level. And that will include some deductions, including earned income, medical costs, dependent care. And so those are all things that you'll want to look at your own state and see what they offer as far as deductions. But then there's also some limited limits to eligibility based on resources, and that can be state to state as well. And you know, the bigger ones that come to mind when we're looking at those other resources that come into play for eligibility are amount of money in a bank account, or if there are additional vehicles to a household that are not used for work. And some of those can be seen as pretty restrictive for people, but that's where the federal government starts with those pieces, and then states can kind of have some flexibility in how they administer those eligibility pieces. Next, household size and age. Many of you have seen the income charts, and I can share one a little bit later here as well of a chart indicating family size and monthly income, monthly gross income that would qualify. And those are really helpful as just like a visual for your clients to be able to see and understand where they are in relation to what 130% of federal poverty level is. And then lastly, there are work requirements for certain individuals and in relation to SNAP. And we'll get into that later. Those are pretty specific, and some are state specific, some are a little bit more general federally. So feel free to put in chat. Does anyone know how many food programs the USDA administers? I'll give you all a second to guess. No takers so far. All right, we'll jump ahead. It's 16. So SNAP is, again, the biggest, and you know, kind of the one that we hear about the most. And you know, I'm sure that many of you have heard of WIC. Many of these are also kind of school related. So they're co-administered with, you know, state, potentially school districts or state departments of education. And a lot of them have to do also with food distribution. So when you're talking to your clientele about SNAP, they may already be participating in another food program that's not SNAP. And that doesn't mean that they're ineligible for SNAP. So think about those other programs and how they may, I guess, be conflated with SNAP. And if your clientele, again, SNAP is a hugely positive program for so many people. If they're receiving some other benefit and they're kind of thinking it's the same, if you're able to kind of have a little bit of information on what SNAP is and be able to encourage them to apply, it can be a huge benefit for them too. There are other kind of related programs. And the reason that I say that they're related is a lot of them share a lot of the same eligibility criteria. And a lot of individuals are participating in these in addition to participating in SNAP. So some of these are workforce related, so Workforce Opportunity Innovation Act, also known as WIOA, also maybe known as your Department of Labor programs in your state. These are often offered at like a one-stop and have some pretty specific criteria on eligibility, but again, may align with SNAP eligibility in a lot of states. TANF, or the Temporary Assistance for Needy Families, also known as like the welfare program or cash assistance, and a lot of times also has workforce supports. and again, aligns with SNAP on eligibility in a lot of cases. Supplemental security income, that is for individuals with little or no income, little or no resources, and disability or older folks. So that's something that, again, can be paired with SNAP to offer additional benefits to individuals. Medicaid, obviously health insurance for low-income individuals, similar eligibility to SSI. And then housing and rental assistance. There are a lot of programs locally, potentially through HUD, Housing and Urban Development, or other programs, many of which community action agencies offer, that have similar eligibility pieces to SNAP as well. So there are a lot of pieces included beyond food benefits to how states work through and need to administer their SNAP program. So first, processing applications, verifying eligibility, income resources deductions, and doing so through conducting one-on-one interviews, oftentimes over the phone or at a county office. And that's at the time of certification and recertification. We'll talk a little bit about recertification timelines in a bit, but individuals have an initial eligibility check, and that's at the time of initial application. And then they have a recertification window every 4 to 24 months. Oftentimes that's 6 months. So that's just something to kind of keep in mind and understand what that certification window is for individuals that you're working with, so that you can support them to get potentially information together if they need to provide additional information, or just know that that's coming, because if they don't answer the phone or reply to their state agency, they may lose their benefits. Next, EBT processing and technology. EBT is electronics benefits transfer, and that's their card. It looks just like a credit card. They're able to use it at food stores. And there is a lot of technology piece that goes along with that for states, a lot of data piece that goes along with that, ensuring that, accounts are set up appropriately, and whether households get one card or two cards, or what that may mean. And then also coordinating with stores that are participating in SNAP to allow EBT purchasing. So there's a lot of technical piece to that, and a lot of administration that goes around cards specifically. The SNAP Employment and Training Program and the SNAP Education and SNAP Outreach are pieces that I'll talk about a little bit more, but SNAP Employment and Training is pretty self-explanatory from the name, but that's the employment and training program that goes along with SNAP eligibility. And then SNAP Education and SNAP Outreach are pieces that are intended to both improve usage rates of SNAP and give people tools to be able to maximize their SNAP benefit. Jumping down to quality control and fair hearings. So quality control, obviously monitoring, investigating, and reducing instances of fraud or skimming or things like that, and ensuring only eligible people receive benefits. And then also conducting fair hearings to ensure consistent, equitable processes are in place for appeals of denied cases or losses of benefits. And then lastly, the call center operations, customer service. So we'd be looking at eligibility workers, or sometimes called income maintenance workers at the state, and their interactions with individuals who are either applying, again, potentially in loss of benefits or verifying benefits or things like that. There often are call centers or online resources for people to check those things and get information, or the one-on-one with county offices. So that's kind of the field office, that's the frontline staff, and a lot of training and things like that go into supporting that staff to be able to provide services directly. And again, some of you may have relationships with your county offices and know those staff and refer people to those staff, which is a really good relationship to have to support your clients. So next, I hope that some of these are familiar programs to you all, and I'd love to hear from those of you who may be contractors or work in these areas. So first, we'll talk about SNAP Ed, which is a program under which states and contracted providers offer training, workshops, information on making healthy meals, choosing healthy alternatives, and getting the best use of their SNAP benefits, and even do some physical activity type programming. So states usually use contractors such as like departments of education, departments of aging, sometimes departments of transportation, and then colleges and universities and their extension offices to get this information out. But also community agencies participate in this as contractors. Curious if anyone on the call is a contractor for SNAP Ed or has kind of interacted with the SNAP Ed work in their states. Okay, maybe none yet, but that is an opportunity for you sometime in the future. Next, SNAP Outreach. So this is really the marketing arm of state SNAP agencies. And again, states use contractors to spread this message in a lot of cases. And a lot of times those contractors are community action agencies or food banks. And what I've experienced with many of these is just the creativity in putting together materials that really speak to the population and really get the word out well. And now, spreading into more social media marketing and using a lot more data to target areas. It's really, really kind of exciting to see the developments in this. And so again, I'd like to open it up to the group here. Are there any agencies on the call who are a SNAP Outreach contractor or do any of the SNAP Outreach work in their state? And if you are, and you'd like to share your SNAP Outreach website in the chat, that'd be great to see. It's really interesting to see how organizations share their information.
Matt, where we found you.
All right, quiet group today. That's okay. If you are interested in sharing any of your information, if you are an outreach provider, again, feel free to pop it in the chat. Love to see any of those pieces. Also, if you're not an outreach provider, it'd be great to make a connection with whoever the outreach provider in your state is to get some of those, whatever it may be, pamphlets or info cards or things like that to distribute to your clients and connect them with SNAP. Then you don't have to create a new piece, and oftentimes those are readily available. Oh, there we go. CAP-LP. Great. Okay. Well, we're going to go ahead and jump on to SNAP Employment and Training, which is the program that I know most about, I'll say, but it's a program in which it seems as though every agency has their own type of workforce program or program to get people access to training. And this is the USDA's program of that sort. So again, providing education, training, employment services to SNAP participants, and especially ABODs, which are able-bodied adults without dependents, and then work registrants. So this is a program that is in some states only open to these folks, but in all states, it's there to help those ABODs and work registrants who may have limited eligibility without participating in a program, the ability to have a program to participate in and be able to meet those requirements to be able to continue in SNAP. So oftentimes states contract with their departments of labor, community colleges, with Goodwills or other kind of employment social enterprise organizations, and with community action agencies to be able to provide these services. And they offer SNAP participants a way, again, to meet those eligibility requirements or for voluntary participants in this program to get free training and career supports. In most states, it also offers the providers of these training services the ability to receive 50% reimbursement on non-federal spending to support participants. And that kind of allows those organizations to reinvest and grow their programs over time. And I know that there are a few on the call here today who are providers and who are learning about SNAP ENT. I'd be interested if anyone is willing to kind of talk about what services they provide to their SNAP ENT clients, for those of you who are SNAP ENT providers. Again, either in the chat or come off mute if you would, please. Haley loves SNAP ENT. I do too. It's great. All right. Well, moving on here, the last piece to talk about here is disaster SNAP or DSNAP, which helps individuals replace lost food due to a natural disaster. And that's both for individuals who are currently eligible and receiving SNAP, and also for individuals who are not normally eligible or not receiving SNAP. And for those individuals who are not eligible normally or receiving SNAP, it's a 1-month benefit to replace food loss in a natural disaster. There are a lot of states that coordinate with local food banks and coordinate with local agencies, especially SNAP Outreach, to be able to share that message when a disaster happens and be on site and be able to help individuals apply, especially for those who are not normally eligible and for whom that application is not something they've ever done before. So that is a really impactful program, especially when people are really at a crisis level during a natural disaster. So all of these are programs, again, related to SNAP, and SNAP eligibility for individuals really opens up a lot of these. But SNAP Ed and SNAP Outreach are accessible to anyone also not receiving SNAP in most cases. So they're really good programs to promote SNAP, promote healthy eating, promote use of benefits in the best way. So next are state options. And I'm going to go ahead and put in the chat the state options report, which is, I'll say, something that I think it's great for you to look at and consider and learn more about those pieces that your state offers and chooses to serve your state the way that they would like to. I'll also say that there's some density to it, so take your time and work through it. And if you have questions, feel free to talk to your local county staff or your state staff and learn a little bit more about those options. But I'll walk through a few of them here today as well. So states have the option to either be state or county administered. And so those state administered states have their kind of central office at their SNAP agency at the state. And all decision making is done from that standpoint. In county administered, it's really decentralized to counties, and those responsibilities that are decentralized include eligibility, SNAP ENT, and other functions. And some states choose to do that to really give local control over those programs. Also, there can be sort of a misnomer with county administered programs because Wisconsin, for example, is kind of a regionally administered program, but they're considered a county administered because it's not centralized with the state. So currently there are 10 states that are county administered, and you can see in that state options report if your state is state or county administered. Next, 17 states offer some type of combined application with SNAP and other programs. So oftentimes those programs that have a joint application are SSI and SNAP, or Medicaid or TANF, or other programs that ease kind of the burden of multiple applications. I'm sure that you all on the call have heard from clients, I have to fill out another application. And so being able to streamline that a bit really takes away some of that stress and takes away some of that repetition for individuals and makes these programs a lot more accessible. I'd mentioned before certification periods. So states have some latitude in how they determine that. So again, the minimum is 4 months. The maximum is 24 months. I think that the national norm is somewhere around 6 months, 6 to 8 months. Every 4 months is a pretty heavy lift for SNAP recipients and also SNAP eligibility workers. 24 months is easier on everybody, but a lot of things change over a 2-year period. So that's a little bit less frequent because things, again, households may change, household sizes may change, income may change, other circumstances may change. And states really are concerned and want to maintain that individuals, only individuals who are eligible for the program are able to participate. So next, some states include child support in their eligible income, and some states exclude child support from their eligibility income. Some states also disqualify for failure to cooperate in child support. And that may be the non-custodial parent, and it may disqualify both the custodial and non-custodial parent. So those are things that may be helpful if you have programs that specifically serve like young parents or specifically serve parents who are non-custodial. And there are 44 states who don't choose to disqualify for failure to cooperate with child support. So there are only 6 who do. So that's something just to kind of be aware of, and what that cooperation with child support how that may affect your clients. Next, broad-based categorical eligibility. This I'm going to touch on very topical. This can get very deep and very policy-centric very quickly. So make sure that you kind of check over the state options report to see how your state operates this. But states can approve eligibility for SNAP based on receipts of other benefits from other programs. So sort of similar to having a joint application, this is an alignment of a person is already receiving another benefit with relatively similar or completely similar eligibility. That eligibility check has already been done. That application has already been done. So if the household receives some sort of other benefit, that may clear the way to SNAP eligibility. We see this specifically in like general assistance, SSI, or TANF non-cash benefits. And so 44 states offer broad-based categorical eligibility. And And I think that it really has been shown as a positive practice for a lot of states. Also, um, this may also help individuals who are interested in SNAP or interested in other programs um, not be subject quite as specifically to the um, other resources limits that states have in place. Again, that's state to state, in some cases county to county, but it may be a little bit quicker and easier way for people to qualify without having to provide information multiple times. The next piece is demonstrations, specifically for individuals who are elderly or have a disability. There's the Elderly Simplified Application project and the Standard Medical Deduction. And those are two SNAP projects focused on households with adults age 60 and over and with people with disabilities. They streamline the application process and certification process by simplifying all of that verification. And they provide 36-month certifications. So you don't have people who may have more extensive health histories and disabilities have to provide all that medical information over and over with a 36-month certification period. It also serves households that do not have earned income. So those individuals who are participating in Social Security or other programs like that as well. Real quickly on ABODs and work registrants, which I'll get into a little bit more detail on here. ABODs are able-bodied adults without dependents. So those are individuals aged 18 to 52 who don't meet another exemption and must either work or participate in a qualifying work program, meaning technical program or educational program, something of that sort, for at least 80 hours a month to receive SNAP. And that is for more than 3 months in a 3-year period. Again, I'll have more on another slide. The visual is helpful with all these numbers. And then work registrants have additional categories that they'll need to fit into. But I'll get to the last one here, self-employment income. So states are required to exclude business expenses for self-employment. And some states have different ways of doing that. So that's another thing. If you have individuals who you're working with who are self-employed and kind of have questions on what they need to include or not in self-employment data for income, there are multiple methods to do so, and some states are you know, have specific methods of doing that. So good to know for those individuals you're working with who are self-employed. So work requirements. Again, I'm going to do this on a relatively high level because this gets pretty weedy as well. So for those individuals who are required to participate in work, there are 3 general categories. And the first is that general work requirement. And that's for 16 to 59-year-olds. They're required to demonstrate 30 hours per week of participating in work, some sort of training, potentially work fair, which is like a volunteer program in which they, I guess for lack of a better term, work off the expense that they're getting for SNAP. And it can be means for disqualification if they're not participating in that in a program that they can document at least 30 hours a week, unless they have good cause. And good cause is can be really a broad number of things, including illness or a family member illness, or maybe there was a natural disaster in their area. There are lots of different things that could be considered good cause. And those eligibility workers or income maintenance workers in the state will conduct those interviews to determine good cause. And receive that documentation of the 30-hour per week minimum. So additionally, there's the ABOD time limit, and that's for 18 to 52-year-olds. I started that because as of October 1st, that will increase to 18 to 54-year-olds, and it'll incrementally increase over time. So that will continue. That may be affected by the next farm bill, and it may not be. So we'll just have to see what that legislation has coming back. So these individuals need to participate, and this says about 20 hours a week. And that's because they really need to participate 80 hours a month. So that averages out to 20 hours a week. And so again, if they don't meet that requirement, they can be disqualified for SNAP. And that is eligibility for 3 months out of every 3 years if they're not participating. And documenting that 20 hours a week. Some states have exemptions for these folks that they can apply. Oftentimes, those are used for if a person is participating in like a workforce program, and maybe they're doing a 2-year degree program. If they reach the end of a semester, that's say the first week of May, and their next the summer term doesn't start until the end of May or beginning of June, they wouldn't be hitting that 20 hours a week in class. So that would be a potential for an exemption that the state would give them. So that's just an example. Lastly, we talked a little bit about mandatory and voluntary SNAP E&T. So if a state has mandatory SNAP E&T for ABODs and work registrants, they must participate, and the state must provide E&T services for those individuals. If the state isn't able to provide a fitting SNAP E&T activity for an individual, they must provide them an exemption. So for those of you on the call who are either providers or working your way towards learning about becoming a provider, one of the big reasons states are looking to expand the SNAP E&T program is to be able to provide services as much as they're able to across the state to help people meet those work requirements. So there may be a lot of administrative work in maintaining a record of all these hours. And the responsible person for tracking those hours is the participant. That doesn't mean that a case manager can't help them, but when it comes down to it, it is that individual's responsibility. So it is the individual SNAP recipient who's providing this information to the state. There are cases in which through SNAP E&T, that communication happens on what program they're participating in to meet that requirement. But it does fall to the individual to track those activities. So sometimes these can align with other programs. So if a person is participating in WIOA and working, that may be able to cover, multiple different avenues to meet those hours. And so if your organization has individuals who have work requirements and you're able to provide workshops, or you're able to provide other pieces to help boost those hours and give them some tangible benefits to move forward and maybe find better employment, those can all be kind of braided together to meet those hour requirements. Also, SNAP E&T has a lot of options in most states to be able to offer. And so if you are a SNAP E&T provider, you offer some of these components. And if you're not a SNAP E&T provider, it may be helpful to look up and learn who in your area is a SNAP E&T provider you could refer people to help them meet these requirements. And those activities in SNAP E&T can include job search, work experiences, sometimes paid work experiences, vocational training options, and then adult basic education or English language learning as well. So here, I want to just kind of talk about thinking about SNAP as a part of the whole and as a part of supporting households as holistically as we can. So many are dual enrolled in SNAP and other programs. So being able to align across these programs can make processes a lot simpler for people. And so whether that's the applications, whether that's categorical eligibility, or whether that's being able to provide some services to individuals to help meet all or a portion of those hours they're required to participate in, that can be really beneficial for households. Not to mention, if they're in a workforce program to meet those hours, they may be getting training that allows them to get a better job and be able to become self-sufficient as well. I do have a note here that some of these efforts to coordinate can be hindered by legislation or hindered by data sharing agreements across agencies. So those are things that, while some states are doing a great job of that, other states are still kind of working in that direction to be able to provide a more comprehensive approach to serving individuals. Also, in thinking about SNAP, it really is important to consider how it is different from those other programs, but it really can align. So thinking about those different pieces of eligibility, how they align, if there's not a joint application, making sure that the documentation provided to verify income in one program can be kind of held on to and readily available for application to another program. And being able to communicate that with your clients, possibly even being able to help them with what office to go to get their birth certificate if they need it, or things like that too. So that's all good information to know. Lastly, understanding and being able to talk about these programs and how they differ can minimize some confusion. I will put in a pretty hard pitch here for SNAP Outreach. SNAP Outreach does, in many cases, have a lot of good information that dispels stigma, or kind of helps answer some of those questions, or I guess for lack of a better term, detractions from SNAP. We hear a lot of times individuals are hesitant to apply for SNAP because maybe they think they don't want to take it because somebody else might need it more, or they want to be self-sufficient because of pride, or they don't want to go to a store and pull out an EBT card because it's embarrassing. Whatever that may be, there's a lot of information out there that we can kind of dispel those myths and those kind of negative ideas, and be able to provide a much more positive view of hopefully this being a temporary support while people are able to get training, get back on their feet, or if it is a long-term need for a person, it's a need, it's food. Who can live without food? Lastly, if this program can be an offset for something else. So if a person is obviously buying food because they need it, but struggling to pay rent or utilities, what can SNAP offset? So if there's a couple $100 there for food, now what can that money be spent on to offset other costs? All good pieces to think about when you're talking to individuals about this, and be able to kind of help encourage them to move forward with not only SNAP benefits, but understand how it interacts with, or how it can be a piece of supporting them overall. Lastly, Farm Bill progress. I want to highlight the second to last bullet there. We are in an election year. It's unlikely there's going to be a lot of movement on it, but we are kind of excited to see that it has moved to the House and Senate Ag committees for review, and there are some plans in place. We've seen the language. There's some really positive pieces. APHSA has provided comment and feedback from our agency members. And there's, again, a lot of positive pieces in there that we hope that can be moved forward. But obviously, we don't know until we see a final version what will be included in there. And from what I've read in this, it looks like there are some pieces that may affect how states individually operate SNAP. And so it's something just to kind of keep an eye on. And then a shameless plug for APHSA's This Week in Washington newsletter to see any Farm Bill updates as well. So I appreciate everyone's time. My contact information's here. But I'd be happy to hear if anybody has questions, or even more importantly, if anybody has best practices that they've used to kind of share SNAP benefits or get the word out, or blend services with SNAP with other programs. It's been really interesting working with Haley, working with NCAP, and learning about a lot of your programs and seeing all the innovation that community action agencies um, have instituted and being able to help people in such unique ways. So I'll open the floor for any questions or comments or best practices. It's okay to have a quiet group, no problems. Oh, there we go. We got one. Be piloting a whole family approach to prevent working in silos. That's great to hear. Those whole family approaches seems to be it's such a positive impact where we've been able to see them so far, and not only in community action agencies, but even trying to bring that whole family approach to our membership at the state level, which is really interesting, really fun, really great to see those efforts. Okay. I'm going to pass it back to Haley, but also I'm going to search here and grab a couple of links for how you can contact your SNAP agency in your state and how you can maybe find information on your SNAP outreach and SNAP Ed. I'll put those in the chat. Thanks everybody for your time.
Awesome. Thank you, Andrew. Just want to quickly plug for evaluation responses. We really appreciate your feedback. We go through all of these diligently. They're anonymous, but it's really helpful to help us curate our future presentations and webinars. So if you could quickly do this, I promise it takes like 30 whole seconds of very not intense thinking. So I believe that you can all do it, and I would really appreciate it if you did. Next slide, Andrew. Also want to plug our 2024 annual convention is coming up right around the corner at the end of August. So if any of your agencies are interested in registering, you can use the little QR code in the bottom. We can also give more information as we continue. But I think that is about all. Andrew, you can stop sharing screen if you'd like. Oh, I see that someone did a response. Thank you. And I think that's pretty much it for me. So appreciate everybody's time and hope you have a lovely Thursday.